That was earlier. I'm already ready. Hi, hi everyone. Welcome back. Happy Mother's Day to all the mothers out there in the world. Hope you're having a great Sunday. This is Markeitha and welcome to Healthy Living. My website is healthyliving.company. There you'll see several things on my website. There's a couple of items. There's Keita's egg toast and gumbo. If you want it fresh, you have to send me a message at my website. The gumbo comes with rice and hot water cornbread. You can also contact me here at the Next Level Studios. That's 310-549-1113. Out there at 310-549-1113. Now the producer of the show is TJ. That's TJAMZ. And you can reach him at tjamsmusic.com. There he has a whole list of songs. You can write lyrics to it, send him messages back. He also does web design. You can also contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, let's get into the coronavirus update. But also, please subscribe to my website. That way you'll stay fully connected to me and any of my updates. Okay, so for the update, I usually retrieve my information from the CDC website, from Medscape website, and then also for my statistics, I go to Worldometer, WORLDOMETER webpage. It gives you the current up-to-date web numbers that are current across the world. So, as of today on 5/9, we have a total worldwide cases of 158,760,544. Now, for his deaths, never thought we would make any of these milestones. Deaths across the world, we have 3,302,466. Now, we do have several million that have survived, but you don't want to get the coronavirus, but this is the number. Worldwide, we have 136,262,659. Now, the U.S. is leading in coronavirus cases and deaths across the world. We're the leaders. So in cases, we have 33,456,913. We're leading. We're still number one. We've been number one since it started, except for China. Then we took over. Okay, also in deaths, we have 595,619. I never thought we would make that milestone. We're almost at 600,000. That's terrible. Now, the third leader is Brazil. In cases, they have 15,150,628. Now, they're the second leaders in death worldwide. They have 400,021 and 484. Now, the second leader, you've been hearing about India in the news, that's totally out of control, and their numbers are increasing. They have the largest, they're second in the largest cases, which is 22,602,596, and third in deaths. They have 245,256. Now, we're supposed to be delivering supplies there. Hopefully they get there, late today or tomorrow, so because they definitely need help in their country. And this is why we need to keep wearing our masks and social distancing and protect us and get fully vaccinated, because that country was supposed to have totally had herd immunity. Herd immunity means everybody's have it, everybody's immune to it. But see, there's variances. And I'll talk about that a little bit later. Those are a little bit stronger. They're mutating. Now, the coronavirus is actually a severe acute respiratory syndrome, and it's made from the SARS coronavirus 2. It's a new virus. It was discovered identified in 2019 December. That's why it's COVID-19. And that was in Wuhan, China. The World Health Organization declared a public emergency of international concern, and that was on January 30th, 2020. Now, later declared a pandemic on March 11, 2020, and it has spread to 219 countries and territories. So this is across the world that this has happened. That's why it's a pandemic. The outbreak originally linked, they thought, maybe to large seafood markets. Also, according to Medscape on 429 in Saigon, a joint China World Health Organization study of COVID-19 provided no credibility answers about how the pandemic began. And more rigorous investigations are required with or without Beijing's involvement. A group of international scientists and researchers are looking at this problem. The joint study said that the likeliest transmission route would be from wild animals, others and wild, like involve like bats and other wild animals. Now, there's now theories that suggest that it moved from animal to person because of the spread. A greater number of patients reported with and without exposure to animal markets, indicating person-to-person spread. Now, the illness can range from mild to death, and it affects different people differently. Your symptoms may appear 2 to 14 days after exposure to someone who has COVID. So that's 2 to 14 days. So when you test positive, you have to look back and see who you came in contact with within 2 to 14 days. Now, the median incubation period of COVID-19 is 4 to 5 days. Most symptomatic people experience symptoms within 2 to 7 days after exposure. People are considered fully vaccinated. Now, this lets you know that people are fully vaccinated. We have 143 million, this was last 2 weeks, that was vaccinated. And then 93 million only received 1 dose when they should have got 2. So I'm encouraging you to get your second dose. It's better for you. So please get your second dose of your vaccination. So people who are considered fully vaccinated is 2 weeks after their second dose series, such as with Pfizer or Moderna, you require 2 shots. Now, if it's the Johnson & Johnson, it's only 1 shot. But it's always 2 weeks after your vaccine when you consider the immune, because you know your body has to react to this to help you build up the immunes in your system. If you don't meet these requirements, you're not fully vaccinated. Keep taking all precautions until you are fully vaccinated. If you have conditions or are taking medication that weakens your immune system, like the steroids, or if you're on chemotherapy, you may not be fully protected. Even if you are fully vaccinated, you need to talk to your provider about your vaccination and what you need to do to protect yourself and what precautions you need to take. Now, even if you're fully vaccinated, they tell you to still wear the mask because you don't know who's next to you that's not vaccinated. So you still got to protect yourself. Now, the CDC has recommended no travel for anybody, but people are still traveling. So I'm going to provide you the information to keep you safe when you do travel. Fully vaccinated travelers should follow CDC recommendation for traveling safely, including wearing a mask over your nose and mouth. Now, you see a lot of people in the public, they wearing their mask below their nose, but their nose is exposed. You have to cover both your nose and your mouth. And also make sure you stay at least 6 feet or more apart, because the virus, when you cough, it can travel up to 22 feet in 60 seconds, 90 seconds, depending on how hard the cough is, okay? So it goes definitely past 6 feet. You want to avoid crowds. I see people out there, they're trying to get out, but they're clustered together. You still want to keep that 6 feet apart. No matter what you're doing, keep your distance if it's related to people who are outside your current living household. Okay, so you still got to keep that distance. You still got to wash your hands. If you don't have soap and water, use hand sanitizer that has at least 60% alcohol in it. Now, people at an increased risk or for serious illness are people who are more likely other than severely ill. Those are the older adults, 50 years and older. Now, 85% is even higher. Now, 8 out of 10 deaths in the United States were 65 and older adults. 8 out of 10 deaths. That's a large number. So if you're living with someone that has these medical conditions or this age, you need to protect yourself because you're going to bring it back to them, and that's how they get the coronavirus. Remember, they're very vulnerable. Some of the medical conditions include cancer, chronic lung disease, including COPD, which is chronic obstruction pulmonary disease, asthma, moderate to severe, interstitial lung disease, cystic fibrosis. These are all involving the lung. And remember, a lot of people die due to COVID pneumonia. Okay, the other additional increase is these clots. You develop multiple clots that can travel anywhere and cause you to have a stroke or heart attack, or if it goes to your lungs, you could die. So you got to be really careful about these people with medical diseases. Also, hypertension, dementia, because dementia, people cannot follow instructions a lot of times. So whoever's their caregiver had to really oversee them to make sure they stay protected. Alzheimer's as well. Alzheimer's is a last stage, a further stage, end stage of dementia. Alzheimer's, they can't remember. Sometimes, and even towards the end, it gets to the point where you have to do all their care for them. And then sometimes even prompting them or feeding them. Now, it also includes diabetes, type 1 and 2. Also includes Down syndrome. Also includes another mental health disorder. Anyone with mental health disorders, you need to supervise them and protect them because you're their caregiver and you're their advocate. Also, heart conditions such as heart failure, coronary artery disease, cardiomyopathies, when your heart is big, hypertension as stated. Also, autoimmune diseases like HIV, of course, AIDS, when it converts to AIDS. Those are weakened immune systems. Now, the primary immunodeficiency is caused by, sometimes, you could be born with it. It's genetic defects or it's inherited. Prolonged use of steroids. So you athletes out there, you don't want to use steroids at this time because it increases your risk for getting COVID. So you want to stay away from those steroids. Now, chronic liver disease such as alcohol-related liver disease. I know a lot of people, because they were closed in, then they had poor coping skills. Some people turned to drugs and alcohol. If you're having problems, please reach out and get help. Because if you're drinking and alcohol, you're not going to be mindful of social distancing or keeping your mask on because you're drunk, right? But all of that drinking also damages your liver. You can have alcohol-related liver disease. You can have non-alcoholic fatty liver disease. That's usually what people who are extremely obese can get, fatty liver disease. And especially cirrhosis of the liver, which is scarring of the liver. Once your liver is scarred, those cells do not regenerate. So you want to protect yourself. Please do not drink excessively. Also, risk factors, being overweight and obese. I was telling you about that. It's driven by the body mass index, or sometimes called BMI. If your BMI is 25 but less than 30, then you're overweight. You're obese when it gets to 30 to 40, and then you're severe obese when you get to anything equal to or over 40. So your BMI, when you go to the doctor, they calculate it based on your height and your weight. And when that number tells you what your BMI is, body mass index. So you want to stay way below that. You definitely want to be below 30. Try to be, 25, 27, okay? Stay in there. Stay with the show. I will show you some easy motion exercises at the end of the show that you can do to help keep yourself healthy. Also, they're looking at pregnant women, increased chances for COVID. Sickle cell disease. Also, trisomy. That's an thalassemia. That is a anemic disorder that you're born with, that normally your body doesn't make enough red cells. So you can take the B complex like I do, or your doctor may recommend iron for you, but you have to be careful about the iron because it can cause constipation. Smoking is also a risk factor. Smoking tends to decrease the blood vessels, so that increases your oxygen and your blood flow to your heart and your brain. So you want to think about stop smoking at this point. It also increases your chance for other heart problems and lung conditions because of the ongoing smoking that you are subjecting your body to. If you were a current or formal organ transplant, if you received them, or if you have blood stem cells transplant, those are also risk factors. Anyone with a stroke or cardiovascular disease, which affects the blood flow to the brain. Also, substance abuse. Remember, I talked about alcohol and then drug abuse as well. Okay, so you want to watch your drug abuse because it inhibits you. It makes you really carefree to where you wouldn't do the normal things you would do if you weren't drunk or high. Okay, so it takes away your ambitions. You're going to do whatever you feel like doing, whether it's safe or not. You're not thinking about that. Now, children have been affected by COVID, but not as much as adults, but it's increasing. Okay, children can be infected with COVID from some developmental serious diseases, or they can have serious illness whether they have medical complexity or not. The serious illness is multi-symptom inflammatory syndrome. It attacks all their organs in their body and they die very quickly. So you need to watch your children. Now, if they have medical complexities, just like I mentioned with the adults, that makes them even more vulnerable. So you really have to watch your kids, especially with the asthma. And you have to make sure that you include and keep their inhalers current and in the house or wherever they are. Also, if you look on the canister itself, there's a black area. It tells you when it's expired. You want to make sure you keep your refills up and not use an expired inhaler. There's a counter at the bottom so that tells you how many pulses are left. So it's very important that you keep any of your asthma children, keep their asthma medication up to date and it doesn't expire, including the one for the nebulizer, okay, that you put in the machine and you give them the mask. They really need that when they get in trouble. If their inhaler doesn't work, then you need to give them the nebulizer. So children are at risk even more with the same things, just like the adults with the different medical disorder, with the obesity and the liver and the asthma and the heart and the lung, diabetes, sickle cell disease, any immune suppressive disorder. Children with multi-system inflammatory syndrome, you need to watch them. They tend to have symptoms. They may be holding their stomach because they have stomach pain. So watch for the nonverbals. They get red rashes on the palms of their hands and their feet. They get this red, puffy tongue. They get redness in their eye, but no drainage like pink eye. Fevers, diarrhea, vomiting. So watch your children. If something changed, don't wait till the next day. Take your child in when you notice something is happening. Do not wait. Another way to protect your children in your household is every adult around those children should be fully vaccinated until they're able to get their vaccination. They're moving towards proven Pfizer and Moderna for children 12 and up. So we're working on that. Hopefully that'll come out soon. But in the meantime, parents, get fully vaccinated. Per CDC, it is severe illness if a person has COVID. This will tell you that this is severe. If you have to go into the hospital, if you have to go into intensive care, if you have to be on a ventilator and then to help you with your breathing, or even if you possibility that you could die. So that's serious. That lets you know that what is severe illness if you get COVID. Okay? People at increased risk who have lived or visit with them need to take precautions to protect themselves from getting COVID. Now, this will explain to you per CDC guidelines on if you're traveling, domestic traveling recommendations for fully vaccinated people. People who are fully vaccinated with an FDA authorized vaccine authorized for emergency use. You see that EUA, that's what that is, emergency use authorization by the World Health Organization organization can travel safely within the U.S. If you are fully vaccinated, take the following steps to protect others that you travel with. So you're not only protecting yourself, you got to protect others, because you may get COVID and you don't even know you have COVID. So you still got to wear the mask. If you don't meet these requirements, then you're not fully vaccinated. Keep taking all precautions until you are fully vaccinated. If you have a condition or taking medication that weakens your immune system, you may not be fully protected even if you're fully vaccinated. And that's when you need to talk to your provider to see what other precautions you may need to take. He may tell you don't fly or don't take a train or a bus. Then you need to listen. So just wait a little while until you're past those stages and where you can be more protected. So please follow your doctor's orders. Please consult with your provider. Now, during travel, you have to wear a mask over your nose and your mouth. Nose and mouth, not just mouth. Nose and mouth. Masks are required on planes, buses, trains, and any other form of public transportation traveling within or out of the U.S. Transportation hubs such as airports and stations. Okay? Avoid crowds and stay at least 6 feet. That, if you're trying to figure it out, it's 2 arms length. So if somebody is closer than you and it's still 1 arm's length, then you already know they're too close. So it should be 2 arms length away from you. That's another good way to judge and measure that you're okay. And then also look for the blue and green, white. They're different colors that tell you about this is where you stand when you're 6 feet apart. So look for those as well that can help you. Wash your hands often using a hand sanitizer with at least 60% alcohol base. After travel, self-monitor. See if you have COVID symptoms. If you do, isolate and get tested and to make sure you don't have the symptoms. Follow all state, local recommendations. Now, if you're leaving California, but you're going to Texas, you have to make sure you check the Texas public health offices to determine what their standards are with following restrictions. So you have to check both where you are and where you're going. So check both locations. You do not need to get tested or self-quarantine if you are fully vaccinated or have recovered from COVID-19 in the past 3 months. You should still follow all of the travel recommendations. Now, that's if you're fully vaccinated. This is if you're not fully vaccinated and you want to travel. If you're not fully vaccinated, then take the following steps to protect yourself and others from COVID. This is all on the CDC website if you want to look it up. Before you travel, get tested with a viral test 1 to 3 days prior to your trip. While you are traveling, wear a mask over your nose and mouth. It takes like 1 to 3 days, depending on what's going on with the testing site, to get your results. So then you know whether you have COVID or not. But make sure you wear a mask. It's required on planes, buses, trains, and other forms of public transportation traveling into and out of the U.S. Transportation hubs such as airplanes and stations. Avoid crowds and stay at least 6 feet apart. Remember, 6 feet apart, 2 arms length. If you're not traveling with someone that's in your household. Okay? Wash your hands often or use hand sanitizer, at least 60% alcohol. Now, after you travel, get tested with a viral test 3 to 5 days after travel. Because remember, the incubation period is from 2 to 14 days, right? That's why they say 3 to 5 days. You should be able to get a positive test by then. So make sure you get a test. And that's after you travel. These are for unvaccinated. And then stay home and self-quarantine for a full 7 days after traveling. Full 7 days. If your test is negative, stay home and self-quarantine for the full 7 days. Just test. Just stay home to make sure you're okay, so then you're not spreading the coronavirus. If your test is positive, isolate yourself to protect from others getting the infection. If you don't get tested, stay home and self-quarantine for 10 days after your travel. Now, Some people are more responsible than others. So if you're going to travel, you need to follow all the travel recommendations. You need to protect yourself and you need to protect others. That's why I'm giving you guys this information. Avoid being around people who are increased risk for severe illness for 14 days. And this is what I was saying, because people from 65 and up are 8 out of the 10 numbers that are testing positive for COVID. So you want to protect yourself. So if you want to be selfish and not protect yourself, at least protect your family members in your household that are 65 and older. Okay? Protect them, please. Because what we're seeing more often is that whole households are getting infected and then 1 or 2 die. So we don't want to have that going on because you didn't wear your mask and you didn't follow the precaution to protect yourself from COVID. So just think about this. This is happening on a common, everyday basis. You see about how other family members tested positive, 1 or 2 died, or we had one family where there was about 4 or 5 that died. Think about that impact, because you want to gather, okay? Or you want to fly and don't protect yourself while you're on a plane or a bus. Self-monitor COVID-19 symptoms. Isolate to get tested if you develop symptoms. Now, remember I said you have to follow all the state regulations. So whatever state you're leaving from to the state that you're going to. So you got to know both recommendations for both states, coming and going. Okay, you have to do your homework. The websites, you can find them. You can just Google them and they'll pop up. You can find them. That's not a problem. Also, they also tell you where you can get tested. So you can always Google that as well. There's testing available worldwide, so it's not difficult any longer to be able to get a COVID test. Do not travel if you were exposed to COVID-19, or if you are sick. If you test positive with COVID-19 or you are waiting for results for COVID-19 tests, then you can't travel. You have to wait till you find out what your results are. Don't travel with someone who is sick. Now, if you're going with a group of people and they tell you that ask them, are you sick? Are you coughing? Do you have a fever? Are you sneezing? Are you feeling very tired? Do you have a loss of smell or taste? I mean, ask them these things. Do you get tired? Is it hard to wake you up? Do you feel exhausted most of the day? So you need to ask these questions before you group up with people who are outside of your household. And they need to be fully vaccinated. And even then, you still need to wear your mask and do the social distancing. Now, there's several different variants. I'm going to try to shorten it up so you can understand it. Now, in Israel, there's the B117. That's the UK variant that's happening. That's breakthrough COVID. People are getting COVID even with vaccination. So that can still happen. That's why you still need to wear your mask. So in Israel, this happened in December, and then it became dominant in January. By the end of January, Hassan Karim at the medical center in Jerusalem had 4 patients in his newly opened pediatric COVID unit, ICU unit, because they had increased kids that are sick, right? And their ages range from 13 days old to 2 years. So we're talking about babies as well as small children. So no one is exempt. So you have to protect yourself and you have to protect them. Viruses are constantly changing through mutation, which is the variant that has 1 or more mutations that differentiate itself from other different variants that are circulating. So different countries have different ones, and I'm going to tell you about some of those in a minute. As expected, multiple variants of the coronavirus has been documented in the U.S. and globally throughout this pandemic. Variants of interest. Variants of interest, specific genetic markers that have been associated with changes in the receptor binding, reducing neutralization by the antibiotics generated against previous infection or vaccination, reduce desired effect of treatments, potentially diagnose impact, or in prejudice increase in the transmissible part, meaning it's more transmittable. It's highly infected. Okay, the variants of concerns, those are the ones that we're looking at right now. Those variants of concern, these are the ones that are more transmissible, right? So there's increased transmissibility and severe disease, increased hospitalization or deaths, significant reduction in neutralizations by antibiotics generated during the previous infection or vaccination to reduce effectiveness of treatments and vaccine diagnosis detected failures as well. Now, there's one that's very high, and that one is severe. That means no vaccines are working, none of the antibiotics, nothing is working. We're trying to avoid those type of things. We don't want to get to the high variant concerns. Now, this is where we are today. This is where we are. The B117, that's the UK variant, 50% increased transmission, meaning it's 50% more transmittable, meaning you can get it even if you're fully vaccinated, okay? Potential increase in severity based on hospitalization and can cause fatality rates to increase. No impact on the susceptibility, emergency use authorization, monoclonal antibiotic treatment. Right now it still works. This is a combination of antibiotics that they can use when you get COVID-19. Minimal impact on reneutralizations and convalescence of post-vaccination. So minimum right now, okay? Now, the P1, this is the one that's in Japan and Brazil. Significant decrease and is susceptible doesn't work through the combination of the monoclonal antibiotic treatment. You hear that? Decrease effect is what they're saying for the antibiotics that they currently use. Now, reduce neutralization even after post full vaccination. So this is a problem. This P1 is a problem. There's also a P2 also. Now, in South Africa, we have the B1351, which is about the same. It's 50% reduction in 50% increase in transmissionable, meaning you can catch it more. Okay, it increases your chances. And we heard about this with the South African. It also has decreased susceptibility to the monoclonal antibiotic treatments that were approved by the emergency use authorization. Reduce convalescent and post-vaccination. So 50% it can increase. That's why you have to still wear your mask, because you can't. We are seeing breakthrough coronavirus cases even with fully vaccinated people. The good thing about being fully vaccinated is it decreases your chance of severe illness and possible death. But with some variants that are coming, you still have a higher possibility, okay? Then in the U.S., we're not exempt. We have the B1427 and the B1429. Now in the U.S., we have 20% that's increased transmittable. Okay, it increases your chances of getting the COVID. It's a modest decrease in susceptibility to the combination of the monoclonal antibiotics that were approved. So that's good for that part. Now, but we still have those other variants out there, and mutations are going to keep continuing to happen because we don't have 70 to 80% already fully vaccinated. So the variants are going to keep happening until we get everybody vaccinated, at least 70 to 80%. So those who only have one shot, you need to go back and get it. Please do that to protect yourself. Now, children and babies are dying. We already heard about that. Now, children in India are also dying. We know everyone's dying over there, period. But everybody can get COVID, even babies. Nobody's exempt anymore because of the variants. Now, per Fox 8 in Cleveland, WHW, a 15-year-old female, Dakota Morgan, she just died a few days ago. And once she tested positive for COVID, she died within 2 days. Now, she lived in Bolingbrook, Illinois, and per her parents, the teen had a headache for about 2 weeks. So they want people to know what their teen went through so you can be more alert watching your children. If your teen or child is exhibiting symptoms that they normally have, then you need to talk to the provider, their primary provider, and get tested as soon as possible. Don't wait. So the parents are telling you guys to don't wait. Then she progressively got worse. She got dizzy. She started coughing, having weakness. She had a fever. And when they finally took her in, she died 2 days later. And she had no underlying health conditions, none. But she was not vaccinated as well. So they also encourage you to get your teens vaccinated. Now, according to the data from Michigan Department of Health, Human Resources, the largest number of new coronavirus cases is among children ages 10 to 19. The first time that happened since the start of the pandemic. Now, what happened is they started opening things up in schools, sending kids back to school, sports, so they started testing positive for COVID. So don't get lax now. Over the past month, incidence of this age group has more than doubled in the States. Cases among younger children, infants 9 and older, are also going up, increasing by more than 230% since February the 19th. That's this year, okay? CDC, now this is how you can protect yourself. This was last updated March the 8th this year. Important ways to slow the spread. Remember I said wear your mask. Cover your nose and your mask. Actually, they recommend 2. I'll give you an example in a minute to protect yourself. Stay 6 feet away from others who you do not live with. Meaning, if they're not in your household, you still got to do precautions. You have to protect yourself. Because then you can bring it back to your household, and you don't want that. You still got to wash your hands. You still got to stay 6 feet apart. If you're going to gather outside from people who are not in your household. Also, if people are older and you're younger and you've been out, you want to make sure you stay away from them, okay, to protect them. Wear your mask. Get vaccinated when it's available to you. Now everybody can get vaccinated. We had a limit at the beginning because we had limited vaccines. So healthcare workers were first because we were taking care of you guys. But there's no limit now. Everybody can be vaccinated, okay? And like I said, hopefully in a few days or a week, we'll get 12 and up. Right now we have 16 and up. So you can all get vaccinated. The summer's coming. I know you're going to want to be hanging out. Memorial Day's coming. People need to get vaccinated. And remember, you want to protect your household. Ask the questions. Are you sick? Do you have a fever? Are you coughing? Are you sneezing? New change of taste and smell. Very tired all the time. Hard to wake up. Ask the questions. Wash your hands frequently. So what you're going to do is you want to make sure that you wear several layers of masks to protect yourself. And you want to make sure that you have, like ours that we work with, we have fit tested N95s. So with ours, we're fit tested, so it fits. And if you have a clamp, you want to make sure you press on the side to make sure it's close. And then they recommend that you cover it with a cloth mask. Okay? Cloth mask. So you have several layers of protection, right? Okay. So you want to make sure that you're protected. So wear those things. And then get you some goggles, goggles that are fog free. And wear those because you want to protect your eyes because you can't get COVID through the conjunctivitis in your eye. So you want to make sure that the goggles are the types that say vent, indirect vent, or no vent so that the virus doesn't travel through your eyes on the side. So I recommend goggles as well as masks. And we'll, stay with me because we're going to take a short break and then we'll do some easy motion exercises to help keep you in shape. Okay, I'll see you in a few minutes. enjoyed you. Whatever you So you got the link on Facebook. You told me you don't put the link. Is the link on there? What about TikTok? TikTok. What about TikTok? Okay, hi you guys and welcome back. So I'm going to show you some exercises that you can do while you're sitting, lying, and standing. Okay, so I'm going to give you the easy versions and you can work your way up. So if you haven't been doing exercises, then make sure you have your back up against your couch or your bedboard. So always hold your tummy in and you're going to go down, up and down with your arms as well, right? And then when you get a little bit better, then you can slide down some more, make it a little harder, right? Always hold your abs in, do 3 sets of 10s to start. And then when you get more advanced, you can go even further, all the way, right? Use your abs, hold them in, and use your arms. Now this can be done on the couch or the floor. That's why these are lying. Okay, so we're going to do some more. We're going to do some. Okay, we're going to do some more lying. So for lying, well, since my knees are bent, let's do these. So for that inner part of your thigh, you know, that rubs together, the friction, this is a good one. You open and close, right? You can also put, when you get further advanced, you can put on the resistive band. And you can do that as well. It'll give you more resistance. So, and then you want to make sure whenever you're opening and closing that you're controlling it, right? You don't want to just collapse it. You want to open and close, open and close. So, now, another thing you can do, since we're here, take the palm of your hands and put them down, and you can do lifts, pelvic lifts, right? You can lift your buttocks up and hold it. Holding your stomach in right now, this is also like isometric because you're just holding it. Or you can do 3 sets of 10s going up and down, whichever way is easiest for you. Now when you get more advanced, you can also take your feet and slide down slowly while you hold yourself up. That's when you get a little bit more advanced, okay? Because that takes strength. But the point is to develop the core, right? Okay, now, you can also do scissors, lower your abdomen, then you can cross them, you can lift them, you can keep them on the bottom, lift them up, right? You can do those. Now, there's another one that you can do for your abs, is you hold yourself up and hold your legs up, right? Hold your abdomen, hold yourself up, right? 3 sets of 10s or to the count of 30. Hold your abs in, right? You can go up and down, 3 sets of 10s. You can do that, right? So that's another thing you can do. Since we're here, you can work on your sides, you know, those love handles, by lowering your leg to one side, right? This is also a good way to stretch your back out in the end when you're done for a warm down. Remember, you want to do both sides. I'm just showing you, but you want to do both sides. If you can't go all the way, go where you can go until you can go all the way. Now another one, and it does work because I'm sweating, right? Okay, so then you can do both legs. Same thing for the love handles. You can go to the side, go how far you can go until you can go all the way, right? So then you do both sides and see how this stretches right here. This is really good for those love handles. And it's also good for your abs. So this is a good exercise that you can do, and it'll help. So another thing you can do is leg lifts. So you can do one leg, however far you can go, right? To wherever you can go. And then you can do them together. You can do low, medium, until you can go all the way, right? And then what you can do, another thing with resistance, you can go very slowly. Keep your abs tight and go down slowly. Okay, that's another one. Now, let's do this one. You can do it without a resistive band, or you can do it with a band to get more resistance. You put it on your knees, right? So put it on your knees. Now this one, what I normally do is, to remember, you want to roll your hip forward. So then I take my arm and I know my hip is forward, right? So then you can lift your knee. You can either do 2 sets of 10s or you can do 30, right? Now, you can also do straighten it out. Remember, keep that hip over. So then you can up and down, 3 sets of 10s, right? Or then you can go back and keep that hip over, and you can do the back lifts. Now remember, you got to do both sides, not just one, both sides, okay? So now we're going to do let's do somewhere you're on your belly. So what happens is you want to bring your heels up to your back, right? So that's going to be your lower buttocks, your thighs, and your lower back rather. It'll help get those moon craters out. So if you can't go all the way, go where you can go. If you have knee problems, you may not be able to go all the way. So go where you can go, because you can still work out, right? Okay. Now, let's do some. We're going to do some standing. Whew. And this works. Sweating like a dog. Very important that you stay hydrated. So, let's do some standing. So, you want to get your core stronger, right? So, standing, you hold on to something solid, like your dresser or something solid, or the table, depending on where you're exercising. Something that's not going to move like this chair. I don't recommend that until you get stronger. So, what you want to do is hold yourself up on one leg. You're going to be utilizing your stomach, your abs, and your thighs, right? And then you switch and do the same thing. So until you can get that done, you may have to hold on to something. So, but make sure you practice that. That's good. Now, also here, you can do side leg lifts, right? Wherever you can go until you can get what you need. You got to make sure you have something stable too that's not twisting. Okay, and remember, you got to do it on both sides, right? Now, also, toe lifts. So, usually in the morning when I brush my teeth, I do baby lifts. Like I lift a little bit. But you want to get to the point where you lift all the way, right? So, you can lift all the way, and if you're not strong enough, you can hold on to something, because I wasn't at first either. So, you can do that. Make sure you go all the way up to the ball of your upper foot, right? Do that. Now, if you can't go all the way, then, do the babies, get started. It's for your ankles, your feet, and it's for your lower calves. You can see that when you go up. You can see how it's contracted, right? So you can do that. Now, let's do what I call standing sit-ups, right? So what we're going to do is, when you're standing, this is what you're going to do. You're going to, keep your feet apart. And if you have back issues, then go slowly so you don't have muscle spasms, okay? So you're going to go slowly. So go down and touch the ground, right? And if you can't go there because your abdomen's in the way or you're not strong enough yet, then touch your knees. You can touch your calves if that's where you can go, your ankles, the top of your foot, and then the floor, right? Hold your abs in. And then you can mix it up by going to the side. So you got the side. Remember, with each one, you got to go all the way up and all the way down. So you got to go up and down. No cheating doing this stuff, right? You got to go all the way up and then down, all the way. Okay? So you can do that. Now, the other thing I want to show you is the squat. So if you want to have your feet apart, so I want to show you how to do it if you have bad knees or if your knees hurt. I'm going to turn to the side because you're going to stick your butt out more. Because when you stick your butt out more, it takes the pressure off of your knees. So when you do your squat, you want to like sitting. So stick your butt out and go down. Stick your butt out and go down. So that takes the pressure off your knees. So it's like you're still like sitting, right? It takes the pressure off. If you don't have knee problems, then you just go up and down, right? Now, if you can't go all the way, go where you can go until you get lower and lower and lower. Okay? Now, also, I'm going to show you these because these are like, I call them baby squats. So you at work, make sure the chair's not moving, and you're just going to get up, and sit down, get up. These are still squats, right? So on your break at work, you can do these. Simple, right? Okay. Now, see, it's working. I'm sweating. Stay hydrated. It's very important. Now we're going to do some exercises we can do while we're sitting. So, from here, you can do like lifts. One or two, right? However far you can go. And then you can do two. Low, medium, high, right? Always holding your abs in. Low, medium, high, right? Okay, you can do those. Then you can do marches, toe marches. You can get you some weights and do your arm curls while you're doing your toe marching. Individual, right? While you're working your arms. Support your arms if you have shoulder problems on the armrest. And then you can also do them together. So you can lift both at the same time while you're exercising, right? Now, if you don't have the weight, don't worry about it. Get you some bottled water. Get you some canned fruit, right? It don't matter. You just need to exercise. Now, the other thing that you can do the same thing you do while you're laying for these inner thighs right here. So just split open and just open and close. And if you want to do that and do your arm exercises at the same time, you can. Because the more that you move, the more you're going to burn it. So that's good. That's more exercise, right? So you can do that at the same time. Now, you can also do the 4-point lift where you lift up, you straighten out, you bend it, and you put it back down. Same thing, right? So you can still do that too, right? And then you can still do the scissors. And you can bring them up, lower them down, bring them up, lower them down, all with keeping your abs tight, right? You can do that too. Now, I do have the chair sit-ups as well. So always hold your abs in on every exercise, right? So what you're going to do is you're going to go down with your arms, touch the ground, and come back up. So you're going to open and close. Remember, your arms are moving too. So you're opening up your arms, right? Go down and touch. And if you can't go all the way, like I say, you can go to the calves. You can go to your ankles. You can go to the top of your feet and then to the ground. This is a good one too for, at the end of your workout if you want to stretch out your back or something like that. And trust me, you're going to feel this, okay? And then come a little closer because then you want to do the sides. You want to mix it up the same way, right? So you're doing both. So you don't want to twist. You want to move to the side, your upper body, right? That works those love handles. Because if you reach over here, you'll feel these love handles over here, right? So that's what that's about, right? Yeah. Now, to work the arms, you can get a band, any kind of band with resistance, tie it in the middle if it's a shorty, put your hands in there. You can put one on the knee and one on your armrest, and you can do curls. This is another way to get those exercises in for your arm, and then vice versa for the other side, right? Same thing. Now, if you want to do more resistance, you go further apart, right? Because then you have to pull to that area. Then you're going to have to really hold your knee and then do your arm curls that way. That gives you more resistance, right? So that makes you work harder when you have resistance there. But if you're not able yet, then don't worry about it. You can do it without, far resistance. You can move slow. You can close your legs in a little bit more and do it the lightweight if that's what you need to start off. There's nothing wrong with that. The most important thing is to get started, right? So that's the important thing. Now, I want to show you my Petler. And this is a QB. And you know what, when I first got this thing, I couldn't even lift it. I had to have my son do it. Now it is heavy. I'm just letting you know it is heavy. But I couldn't even lift it before. So the more you exercise, the stronger you get. And that's why I'm telling you about this. Now this is a QB. It has a resistant dial on the bottom, so you can increase the tension. Also has a speedometer at the top. So the good thing about this is, while you watching Queen Sugar or Queen of the South, or if you're into superheroes, Supergirl, Flash, whatever you into, right? I'm waiting for Power Book. It ain't came yet, but I'm waiting for that one. So anyway, while you pedaling, you can be watching your TV. First, watch your TV show, right? They come on, and depending on the show, it determines how many commercials. So you get to 30 minutes, before you know it, it's 30 minutes, and then before you know it, you've done a whole hour. That's why I said do it with your favorite show, because you're going to be watching and you're going to be forgetting about the time. Now, the good thing about the QB, you can go the opposite direction. You can go forward or you can go backwards, either way. Okay? So if you don't have the weights, don't worry about it. There's water bottles, there's canned fruit, whatever. The main thing is to just get to exercising, right? And so, now if you know you have a fluid problem, you need to talk to your doctor about that so your doctor can advise you. But your doctor will always tell you exercise helps to improve fluid. So it helps to get rid of it. Although, it comes back, but at least if you do it every day, it won't be out of control, right? So I need you to commit to at least 60 minutes a day. Now, I gave you enough exercises to rotate with, because you have to rotate, because your body gets used to certain movements. So then it doesn't respond as well. So you got to rotate your exercise. So there's no excuse not to exercise, because I gave you examples to do while you're lying, even while you're on the couch, right? Sitting now, and I also gave you standing. So everybody needs to move. The body is made to move. And then remember, obesity is a COVID high risk. So you want to make sure you're keeping your weight off. I know people have been stress eating because of COVID. Well, now you need to get to working, eat healthy, order online so you have good food choices, and start exercising. That's very important that you do that. Now, the other thing I want to make sure is that, people are under the impression that this is over, and it's not. We're not there yet. So we have to keep wearing our masks, 2 masks, okay, because you want several layers. You don't want it so there's holes on the side. Put another cloth mask that's fit tighter so you don't have any openings on the side. I'm going to show you what I'm talking about. And then online, there is a few N95s that you can order, because I ordered some. So this is what I'm talking about. So let me just show them this. Okay, so this kind of mask, so if you notice there's gaps there. You don't want the gaps. So you want to make sure you put another mask over it so there's no gaps. Okay? That's why they recommend 2 masks. So if you want to reach me, you can contact me at healthyliving.company. There you'll see different articles on my website, food products. There's keep this egg toast gumbo. Remember gumbos with rice and cornbread. Send me a message because I have to make that for you specially, fresh. Also, you can watch all my previous shows. If you're a Facebook friend, great. You can watch it anytime. Or you can go to healthyliving.company, click on the previous shows, and you can watch all my shows whenever you feel like it. Encourage your friends and family to watch. This is also important. We're not out of the woods yet. I want you to stay safe. Now, the producer of the show is T Jams. That's TJAMZ. And you can reach him at tjamsmusic.com. He writes all the music for the show. There's songs on the website. Write lyrics to it, send a message. He also does web design. You can also contact him here at Next Level Studios at 310-549-1113. 310-549-1113. So stay safe. Just remember, don't bunch up, don't clutter up, stay spaced out, don't crowd up. That's what people not from your own household. Get vaccinated. If you have one, get the second one. This is the only way we're going to get out of this pandemic if people get vaccinated. So don't get mad if things ain't opening up. Go get your shots so you'll be part of the solution and not part of the problem. Okay, so stay safe, and I'll see you in a couple of weeks. Happy Mother's Day, everybody. Bye-bye.